Now a brief intro to our guest speaker, Leslie Murphy. Leslie's had a private acupuncture practice here in town for 10 years and is licensed by the Massachusetts Board of Registration in Medicine. She's a graduate of the New England School of Acupuncture, where she was awarded the SAY Fellowship by the SAY Foundation of Chinese Medicine, given to an outstanding graduate most likely to make a significant contribution to the profession of acupuncture. So please help me welcome Leslie Murphy.
Thank you. I appreciate that, and thank you, Libby, for all of your work getting this here so we could have this time together, and thank you too for the library and the Friends of the Library for having me. If you guys are here because you want to talk about stress and anxiety in a new light, or if you want to learn a new effective, easy technique that you can then use as soon as you walk out of here to manage your stress and anxiety better, then you're in the right place. Like she said, my name is Leslie Murphy. I've been in Middleborough for about 10 years, and I can honestly say, or I count myself lucky as one of those people who can say she truly loves what she does. I love treating hi, welcome. I love treating all the patients in my office for a wide range of conditions, but I do love treating stress and anxiety because I can really see the impact and the change it has in people's lives. But in addition to treating patients, I really do love talking to the community, not only about educating people about acupuncture, how it works if people aren't familiar with it, if it's something new to them, but also really educating people so that you can essentially have tools and techniques to heal yourself at home, because I honestly think that's sort of what it's all about, right? So that we can all heal ourselves. I think that's important, because if we're happy and healthy people, our family members are going to be happy and healthy, our community is going to be happy and healthy, and we kind of need more of that, I think, these days. So what I want to accomplish today for our time, if you can see that, I'm going to start talking about how we view stress and anxiety in society today, and hopefully maybe give you a little mindset shift on how you look at it in your life. Then I'll do a quick overview, just talking about, what is acupuncture, how does it work, in case you're not familiar with it, and laying that framework. And then I'll go into talking about how we view stress and anxiety in traditional Chinese medicine, how it's viewed a little bit differently than in Western medicine. And then the fun part, we'll kind of get into how we treat it, and I'll talk about some of my favorite acupuncture points that I use in my stress and anxiety treatments. I'll help you guys find them on yourselves. We'll do a little bit of acupressure practice so that you'll know how to do that. And again, you can leave here, teach your family, friends, so you always have this technique to draw upon when you're either anticipating a stressful or anxious time, or you're sort of already in a stressful and anxious time. So you'll be able to use that. And I'll definitely leave time for questions at the end. But honestly, if you have questions as we go along, just feel free to stop me so you don't have to worry about holding those to the end. Okay? Sound good? Can you hear me okay? Am I projecting okay? All right. And if I start talking too fast, which I do when I get excited about a topic, just let me know that too. All right. So I wanted to start off by talking about how we view stress and anxiety, how we really talk about it in society, what are the current messages that we really hear about it. And more often than not, it's sort of in the negative, right? That stress and anxiety is somewhat bad, and it can be harmful or detrimental to our health, which, it can. They talk about how it can impact our cardiovascular system. It can really impact our immune system, making us more vulnerable to colds and flus. It can lead us, make us more susceptible to depression, what have you. So really the message is we need to try to avoid it, right? We should really minimize how much we have in our life. We need to really work hard to overcome it. And I think the goal in those messages is to hopefully spur us to more positive behaviors, to really try and manage that stress in our life. But really what they found is it's kind of doing the exact opposite, right? Hearing all this negativity about stress and how harmful it is is almost then leading people to more self-destructive or negative habits to help cope with and try to avoid sort of their stress and anxiety in their life. And that could be alcohol and drug use, it could be smoking and now marijuana use, to overeating, to just procrastination on things, to social isolation, and not really improving people's stress levels. So, but is stress and anxiety really that bad? Is it really that harmful? And I would say no, as would a researcher out of California. She's at Stanford University, I believe, Kelly McGonigal. She would say no, there's actually an upside or many upsides to stress that really aren't ever talked about. But she really outlines that in this book, which I highly recommend. They got a bunch of copies that you read this book. It's a winner. I've highlighted so much as I was going through it. But she starts off her book highlighting one research study in particular. I believe they started it in 1998. They looked at 30,000 people, and they asked them two questions. One, to rate how much stress they had in their life over the past year, and how they viewed that stress. Did they believe that stress was harmful to them? And so then 8 years go by, and they go back and look at those participants, and they scoured health records and so forth for them. And what they found was that people who reported having an extremely high levels of stress had a 43% increased risk of death. So yeah, that's not very good, right? But she says, if you look further into that research, it was those people who reported that high level of stress, but also had the belief that that stress was harmful to them, is who had that 43% increased risk. Whereas other people in the study who had reported just as high level of stress, but didn't believe that that stress was harmful to their health, did not have that increased risk of death. And in fact, their risk was even smaller than those people who reported having no or very little stress in their lives. So she's sort of setting the premise that it's really not stress in and of itself that's bad or harmful to us, but it's having that high level of stress coupled with the belief that it's harmful to you is what is detrimental to our health. When in fact, like she said, the many upsides of stress, which she highlights in other studies in her book, is that stress actually makes you smarter, it makes you stronger, more successful, it inspires courage, compassion, and socialization. And even during times of high stress, we can experience all of those things. So really changing your mindset on how you view it can not only improve the longevity of your life, but the quality of it too. Yep.
Would you think that stress is just a problem in search of an answer?
Sure.
Something like
yeah,
that?
exactly.
If you look at it like that, it don't become so much as stress.
Correct.
You know there's something causing it.
Right.
How do I solve it?
Right. And she even talks about, which I found really fascinating, I'll blank on his name, the gentleman who sort of coined that term of stress. And if you read about the studies that he did to look at stress and why it was so bad with rats, it's just, extreme torture that he's basically putting on these rats for an extreme amount of time, when really that's not our normal stress necessarily. Yeah.
Is that this psychiatrist, Bernard Skinner? The Skinner box and all that sort of?
Maybe. I can't remember off the top of my head. I'll have to look in the book in a little bit, yeah. But it was really fascinating reading about his studies too, or I almost had to flip through the pages. It was a little disturbing.
The box to precondition her so when she grew up she would be a model person, and it didn't work.
Oh, this was on people. Okay.
Yeah.
Oh, well. Okay, interesting. All right, so where was I? So she would say it's really, and I don't mean to say, and she doesn't mean to say either, that we just have to like, oh, okay, stress isn't bad, so now my life's going to be all roses and rainbows, right? That's not necessarily true, because stress and anxiety is just sort of a part of our lives, because we have stress about those things that aren't leaving us, right? We worry about our jobs, we worry about our loved ones, we worry about our homes, things like that. So really what she's talking about is changing our mindset so that we recognize stress is not all bad, and it's not just about eliminating stress. That's not really the focus. But really it's about adopting this new mindset that there are upsides to it and figuring out how to do better with stress and anxiety. And by adopting these 3 most protective beliefs about stress can really have a profound impact on your life. And the first one being viewing your body's stress response as helpful and not debilitating. If something's coming up and we're really anxious about it, right? Our heart starts beating faster, our palms start sweating. Viewing those physical responses as just a way of, okay, your body's giving you that energy you need to handle the situations that's coming up. They're not signs that you're somehow not managing, or signs that you're not going to be able to deal with this properly, right? Second belief being viewing yourself as being able to handle, learn from, and grow from the stress in your life, as opposed to knowing that you have stress and anxiety and that's somehow a sign that you're not in control, or this is all happening to you and that there's somehow something is wrong, right? And I really like the last one that she says, viewing stress as something that everyone deals with. It's not something that somehow proves how uniquely screwed up you or your life is, right? So we all go through it. We have that camaraderie, and adopting those beliefs can help us do better with our stress and anxiety so it doesn't have those harmful or debilitating effects on our health. So how do we really do better with our stress, right? How do you manage it when you are in sort of the throes of it? Well, I'm a big proponent of gathering what I call your self-care toolbox, right? And what I mean by that is really just figuring out the tools, the techniques, the strategies, what have you, that really resonate with you. They're going to help you manage your stress and anxiety. And they might not work for your neighbor, for your spouse, for your friend, but as long as they resonate and work for you, that's what you need to cultivate and draw upon. And those are going to be the tools that help you reinforce those 3 beliefs that we just talked about. So they're going to be things that can help you address the physical response and the emotional response that you have when you're under stress. They're going to reinforce that you're capable and able to handle it, because they're helping you manage through it. And they give you an opportunity to be more in control. And many people come to my office for treatment for stress and anxiety because they are looking for natural ways to manage it. I mean, yes, there is always medication and it's needed in some cases, but if it's something that you don't necessarily want right away, or you're worried about side effects, there are definitely natural ways to handle it. And that's sort of what we're going to talk about now going forward, that acupuncture and acupressure are sort of 2 tools and techniques that you can use to address and manage your stress and anxiety. Okay? So let's dive into those. Who here has had acupuncture before? Anyone? Or is it everybody new? Okay, a couple people, good. But I like newbies too. Sounds good. Well, I'll tell you sort of what acupuncture is not. Maybe we'll start there, right? It's not this latest, greatest, fad that's going all around Facebook, lately, to say, here's how you're going to manage your stress and anxiety. When in fact, it's been around for 2,000 years because it's effective. And it's been used worldwide, not just as sort of a complementary, and what we sort of pigeonhole as sort of an alternative treatment, but also as a primary mode of treatment. And it's a complete form of medicine, so we're able to treat the whole body. I think most people consider it just for pain, if they're somewhat have heard of it, but really, it treats a wide range of physical symptoms, conditions, but also the emotional and mental. And I'll probably reiterate this a lot this morning, where we really don't separate the physical and the emotional in traditional Chinese medicine. And also, acupuncture honestly is just one branch of traditional Chinese medicine, along with the importance of nutrition, exercise like Tai Chi and Qigong, herbal medicine, and Tui Na massage. But if most people, if you've never heard or know much about acupuncture, there's probably one thing that always pops into mind, right, when people hear about acupuncture. And what is that probably? Needles, right? So let's talk about those and get them out of the way. And here, you answered my question, so you can have one of my stress brains. So needles, right? When we think of needles, particularly in a medical setting, we immediately think of a hypodermic needle, right? And hypodermic needles are the complete sort of opposite of acupuncture needles. And actually, while I talk about them, I'll pass them around. I just ask that you don't open the packages, if you don't mind. But hypodermic needles, they're thick, right? They're hard. They are hollow because they either got to pull something out of the body, right, blood, or they're trying to push something in, medicine or vaccine, what have you. And yeah, I honestly don't like them either. I'm not a fan. They hurt, right? Whereas acupuncture needles, they're very thin. If you can look through the plastic tube in there, we say they're like the size of a human hair or a piece of thread. So very thin, very flexible. And they honestly really only go in the skin a couple of millimeters. It sort of depends where in the body we're inserting them. And I would say 99% of the time, first patients, the first needle goes in, their exact words are always, "Oh, that's it? I didn't feel a thing," which is great. And that's how it should be, right? It's not pinchy, painful, or whatever, which it's sort of hard sometimes for people to wrap their brains around that. But yeah, it's a needle, but really, it's quite comfortable. And I joke that I always hear two sounds coming out of my treatment room: stomach gurgling movements and then snoring, after the needles are in. People are conked out for their naps, which is great. So we know it can treat the whole body. We know it does use needles. And I should also say, you're not covered with them. So we can take out any sort of pictures of Hellraiser or whatever we have in our minds where people are covered with them all over our face or all over our body. That's not the case either. They're selected for you, for your particular needs in that treatment. Most are placed anywhere from like elbow to your fingertips, knee down to your feet, sometimes abdomen, sometimes the back, kind of depends person to person, but you're not covered with them by any means. Although many people are like, "Give me all you got, I'll take them all, I'll stay here all day," when really more isn't necessarily better. But delving into how it works, good or bad, there really isn't one distinct answer to answer that question. How does acupuncture work? But in a way, I think that's a really great thing because there are so many ways that acupuncture influences the body, so many mechanisms at work once the needles are inserted into the body. And I think that's why it can then treat a wide range of conditions. So it's shown to increase circulation, regulates the immune system, so can not only strengthen your immune system against cold and flu, but can treat autoimmune issues. It reduces inflammation, reduces stress and cortisol levels in the body, and then produces endorphins, those feel-good, calming hormones that we have in our body. And several of these mechanisms come into play when we're treating stress and anxiety. An analogy I use a lot in describing it is, we understand that blood's flowing through our arteries and veins, through our circulatory system, right, through our veins and arteries. We understand nerve impulses are traveling from our brain throughout our peripheral nervous system. And as long as, everything's flowing correctly, we're happy, we're healthy. But if a blockage occurs for some reason, that could be because of injury or trauma, obviously, diet, our emotions, the weather. If there's a blockage somehow, that's when uncomfortable signs and symptoms begin to occur. So say you have a big garden at home at your house, right? And you need to water those plants so that they can grow. You go off to the side of your house, you turn on the spigot, and you've got your hose and you're watering your plants. But say you have a really big garden, so you go around the corner of your house and, the hose gets stuck and a kink forms in that hose, right? So even though the spigot's still on, the water is getting backed up, but hardly any of it now is trickling out to nourish your vegetables or your flowers. Easiest way that you correct that is you find the kink, straighten out the hose, so you're reestablishing that flow of water, right? That's essentially, what the needles are doing to the body. They're saying, hey, there's some kink here, there's some blockage, right? Either energy and blood is getting stuck, causing pain, headaches, stress, what have you, or not enough, blood and energy is getting to an area and nourishing it, causing fatigue, anxiety, dizziness, whatever. So let's clear out that blockage, reestablish that healthy flow and circulation so the body can essentially heal itself. So there's nothing coated on the needle. There's nothing special about the needles themselves. What's special is sort of where they're put and why, and really just helping the body heal itself. So any questions sort of about that piece of acupuncture? Okay.
Oh, sure, I do.
Yeah.
I remember the last time I went, I had some kind of a serious disease, whatever, pain in my throat. You know where she put the needles?
Where?
On my feet.
Yeah.
I couldn't believe it.
Well, I get that a lot too. Someone will come in, I have a headache. Why are you putting them in my hands? And that's kind of an interesting thing too, where sometimes you go locally to the area and other times, you work distally and that type of thing.
Connection? In other words, the whole body's connected. It doesn't matter where you put them, or there's a special channel that only exists.
There are, what's considered acupuncture channels that run throughout the whole body. So it could be, if, your throat on a specific channel, you're needling sort of the opposite end of the channel to kind of clear and move things out. So you could choose points based on channel. You choose points based on sort of the mechanism that they have in the body. So lots of different approaches that in terms of how we choose the points that we're gonna needle on somebody. Does that answer your question?
It's a great experience. I love it. If I had the money, I'd go every day. I really would.
Well, and regardless of what someone comes in for, everyone usually always feels relaxed, which is the great added benefit. Yeah. Well, let's sort of dive in then into how we look at stress and anxiety in traditional Chinese medicine. And again, I talked about how we really don't separate the physical and the emotional in Chinese medicine, that they are very connected. So we first sort of look at what are the underlying emotions that someone is feeling at the time. Because someone will come in and it's like, I'm dealing with anxiety. Well, my first question is usually, well, what does that mean to you, right? Because it's sort of different for everybody. So first off, I want to kind of look at what are the predominant emotions, because each emotion sort of correlates with an organ system in the body. Easiest way to kind of understand that connection is, say, most people probably at some point in your life, if you're nervous, you're worrying, where does it hit you, right? Usually your stomach, right? You get the butterflies, maybe you get some nausea, maybe it influences your bowel movements. So that's a kind of easy way to understand how, emotions can lead to physical symptoms and vice versa. Physical symptoms can then also lead to your emotions that you're feeling. So guilt and sadness correlate with the lung system, anxiety, overexcitement, overjoy sort of with the heart. Worry and overthinking, as I mentioned, is more the stomach and spleen system. Anger, irritability, sort of impatience is more liver root problem going on. And fear, lack of will, or even shock is more related to your kidney system.
Could we go through each of those, because I'm trying to figure out if you're sad, what is it, your breathing is suppressed? Is that what the connection is? I don't get that one.
It can be, yeah, where if someone is very sad, you know, even dealing with grief, right, they might even be starting to hunch over, right? Or more shallow breathing. Yeah, so you start to have more of those, or even, you know, the lungs are also related to your immune system, so maybe they're having more colds, you know, susceptible to more colds, that kind of thing. Yeah. Where like anger, irritability with the liver, like someone, you know, you're got a lot of road rage, someone's, your diaphragm might not move, so someone's gonna sigh a lot more, right? Because your body's trying to move that anger and irritation so you can breathe. It's also very related to migraines and headaches. So all sort of connected in terms of that emotional and physical.
What's the connection between fear and your kidneys? Kidneys flushes out waste, but I don't know.
Kidneys are considered your what do you call it? Your sort of who you are, right? It's sort of your what's the easiest way to describe it? What's that?
It's a washing machine.
Well, that
filters out everything and keeps everything circulating clean and removes all the impurities.
True, and that's like your literal kidneys, right? So in Chinese medicine, when we look at sort of the kidney system, it's sort of more looking at the roles and responsibilities of that energy system in the body, which is more like your growth, reproduction, you know, maturation, that kind of thing. So fear, it's more like how it would impact your kidneys. Dark circles under your eyes, exhaustion, adrenal fatigue, probably more like copious urgency and urination, that type of thing.
I remember there's this great acronym. FEAR really means false emotions appearing as real. You ever heard of that?
Oh, I haven't.
Yeah, isn't that interesting?
I do. I like that. Well, let's sort of dig into stress then a little bit more and how we view it. Really, for most cases, not all, it's considered more, or we view it more as like a circulation issue in the body. So I kind of like it to a traffic jam in the body. So say I have a meeting up in Boston, I'm in my car, I'm driving on 495, and all of a sudden there's a slowdown and I come to a dead stop, right? Oh, so then the stress and anxiety starts to come on. I am going to be late. This is not good, right? I start getting irritable and impatient. Why are all these people on the roads? You know, get out of my way. Let's move, you know, and then you start to grip the steering wheel a little bit tighter. Your shoulders are coming up towards your ear, like, not good, right? And then say, you know, you're really not moving. What is going on? You come to find out there's some tractor trailer. All of its contents are out across the road. Nobody is going anywhere, you know, so you're at a dead stop. So then what happens, right? It's almost like the stress gets worse, so it starts to spread, right? Now we're seeing backups on more of the side roads. You know, 24 is starting to slow down, 140, 28's noticing it too, right? Same sort of thing happens in your body when we're under sort of more prolonged periods of stress or we're not managing, right? The symptoms start to spread, or we see more issues of this circulation not happening. So maybe you start seeing your blood pressure start to rise, have more occurrences of reflux or indigestion or constipation, right? Because literally things are not moving. Migraines, headaches, those tight neck and shoulders, it now moves to overall body tension or pain, and it can lead to insomnia, where we see more waking between that 1 and 3 a.m. time period. So really seeing stress as this issue of circulation in the body. But anxiety, we kind of look at more, if we continue with the car analogy, is more of like you're running on empty, right? See it more as a nourishment issue. Like your tank is just not getting full, or you're filling it, but it's just being drawn upon, and so it's staying empty. And what really is it that nourishes our body, right? It's our blood, right? It carries the oxygen that we breathe. It carries the nutrients from our food. So as long as our blood is sort of full, strong, and flowing all around, then we feel grounded, right? It's nourishing our brain. We feel less anxious. But if we are running on empty, that's when sort of the anxiety starts to creep up, the worry, the fear, the emotional upset, and we feel less grounded. And then if it stays longer and continues, you might have heart palpitations, insomnia, which is more of a case where it's having difficulty falling asleep, poor memory, fatigue, exhaustion, what have you. And another example I use to stress how important the idea of blood is in Chinese medicine is if you think about women post birth having a baby, right? You know, most cases there's a lot of blood loss when you have a baby, right? And depending on the woman or how much blood loss there is, leading her to be a little bit more unsettled, ungrounded, and even having postpartum depression because of that blood loss and having, that sort of running on empty feeling. So how do we then treat stress and anxiety? Well, then we select points that are going to work on not only those emotions that we identified, but also those physical symptoms that come along with it. We're going to select points that help increase the circulation and help build our blood to help our symptoms. And again, it's really just triggering your body's own response, and hopefully not having any side effects that you would if you were to add something right into your body. So once the needles go in, it's really turning off that sympathetic nervous system, right? That's your fight or flight system that is meant to turn on, but then turn off once that stressor is kind of gone, right? But nowadays it sort of seems the button is pushed and it stays pushed, and those cortisol levels are sort of pumped throughout our body. So the needles really help turn off that sympathetic nervous system, reduce our cortisol levels, and then in response turn on our parasympathetic nervous system, that rest and restore system that also helps release endorphins so that we feel calm, and so forth. So that's essentially how it works. And, I want to just really spend the rest of the time then, unless there are more questions, going over, well, what are some of those points that we would use, and how can you then use them at home with some acupressure. So hopefully I didn't sort of rush through all that, but does anybody have any questions? Yeah.
I'm very familiar with this because all my life I had to use it. I was in high-stress situations, sales, the military, and so forth. So I'm not bragging, but I had to learn it to survive, and I'm very easy with it. The reason I came here is a good friend of mine and his wife. I wanted them to see it because they needed it, and I can't persuade them to come because they're defensive, as if to say they're in denial. They know they need it, it would help, but they don't want to be bothered. I mean, gee, if I don't know about it, it's not going to affect me. How do I persuade him to get off his, backside and get in here?
Well, you're a good friend for thinking of them, and that's hard. I always, if people usually ask me questions, it's someone has to approach them at the right time for them, right? For them to do it.
I can't do it.
Exactly, right. So, you maybe take a book for them to read. I should say, she talks about not only just studies on stress, but also anxiety too, that I found really fascinating. And she writes it in a way, not just for like a scientist, but for us lay people to understand.
You know what? Are you familiar with the professional ballerina? Her name is Miranda Esmond White.
I'm not.
You'll see her on PBS a lot when they do these money things to get the public to.
Oh, yeah.
And I saw this many years ago for the first time when I was in Denver, Colorado. I was in the hospital, and as soon as I saw it, I said, oh my gosh, this is something that professional athletes ought to use. In other words, how to keep your body flexible without overdoing the weightlifting, because you get so heavy. No wonder you have the injuries, your body can't support the weight. And so I bought it for my friend 2 years ago when I was in the hospital again, because I thought, gee, if he would see this, it would help him curb. He has rheumatoid arthritis, which is so bad he can't stand up. And she shows you how to bend and stretch, and you can overcome it without surgery and all the rest. Do you think he watched it?
Well, like I said, you can only just keep, sharing messages that work for you. And if, one happens to bite, then great, but you can't really force somebody with anything, right? Unfortunately. Yes? 1 second. Yep.
Do you have a favorite book you would recommend about the acupuncture for a beginner patient?
Yes. One, I can't think of the author off the top of my head, but it's called Between Heaven and Earth. It's a really good one that talks about it, but, it's not just for the acupuncture student, to read. The Web That Has No Weaver by Ted Kapchuk. He does I think it's called The Web That Has No Weaver. The Web That Has No Weaver by Ted Kapchuk. It's with a K. He's he's a well-known acupuncturist. He's done a lot up in Harvard. He wrote that book. That one might be a little bit more dense, but it's a really great one too. Those are the two off the top of my head that would be good. Yeah. Yeah.
That parasympathetic
Mm-hmm.
that turns on and restores
Mm-hmm.
the good nerves,
Mm-hmm.
would that be good for the neuralgia?
Yes, definitely.
That would be something that would work for that?
Mm-hmm. And our parasympathetic nervous system turns on, at night when we're sleeping. But, who's getting great sleep these days or enough? Not a lot of people, right? So, people after usually their first acupuncture treatment, they get off the table and are like, wow, I feel so relaxed, almost like sleepy, because they're not used to that feeling for so long, right? So it helps calm the nerves. And more related to that, one of the mechanisms that how it works, I'm probably going to get these mixed up, but with chronic pain, you have these gates that they call them in our nervous system that I believe are opened when you're in pain, right? But they stay open when you're in chronic pain. But acupuncture is shown to be able to close those gates so that you're no longer in that chronic pain cycle. And so that would
Because they told me the
work with
nerves are
neuralgia.
inflamed,
Mm-hmm.
and they just need the time to settle down.
Right,
So I need to find something
right.
to settle
Oh, I
down.
know what the answer is.
Right.
You know what, now they're recommending marijuana, because it relaxes you so much that it helps
I
you
don't
with
think
sleep.
so. We're not going there.
Well, you lose.
Libby, yes, Libby.
Between Heaven and Earth is by Harriet Beinfield.
Yes, thank you.
I've got my own set of problems.
Yes.
If you have a treatment, how long do you feel the effects of it
Mm-hmm.
for? Is it like something you have to have like weekly?
Yep, great question. Typically with stress and anxiety in particular, you're going to feel the effects usually that first visit, right? But, I think the easiest way to answer that is twofold. One, it sort of depends person to person, right? And I think that's a really great thing about this medicine is that it's very individualized, right? It's not just here's one-stop shop, everyone gets the same treatment if they come in for one thing. It's really what's going on with you, what's sort of that root cause, so what should her treatment be for you? So, and everyone sort of responds differently. But that being said, I think with stress and anxiety, I usually gauge people or tell people for most conditions, sort of the 8 treatment range is a really good one. You're probably going to feel things before then, but really sort of by 8 is where we're really getting some good traction. So unfortunately, some people come to me, I'm like the last resort, and they want to feel better now. Of course, who wouldn't, right? But if I could have people lose 20 pounds after one visit, I would have a line out my door, right? It takes time. Each visit sort of builds on the next, right? It has a cumulative effect. So I do initially say it's really important, time and money-wise, to be consistent, right? Because who wants to feel a little bit better, but by the time I see you again, we're back to square one. So you're just sort of doing this as opposed to gradually increasing. I also pull in this image of like an iceberg, right? If you've ever seen a picture of an iceberg, once it sort of breaks the surface of the water, if you look underneath, it is huge, right? Underneath, right? And that's typically what happens with our health, right? Things are building and taking a while to develop before we're really experiencing symptoms, right? Or symptoms enough that it's going to show something on a blood test or some other test, right? So we're trying to chip away at this big iceberg, right? So each visit's going to do that, but is it going to be able to melt this whole big chunk of ice after one or two? Probably not. But so to answer your question, it's going to take, a significant or certain visits on a consistent basis. Did I answer it? Question? Okay.
I know insurance some insurance will cover acupuncture, but normally how much do they cover? Do you know? Like, do they have so many visits, or does it just depend on the insurance?
Insurance is one of those tricky beasts, right? Like, not many of our run-of-the-mill Blue Cross, Blue Shield, whatever, actually do cover it, though I always tell patients check into it just in case. Some will only cover it. I saw one, maybe it was Cigna. They only covered back pain, like certain things. And those certain things were because the research showed that it worked, right? Well, and this is getting to a whole other thing. Acupuncture doesn't fit the typical Western medicine research trial. Like, that's just not how it works, but that's what they try to show how it works. So I would think it would probably be like a chiropractic visit. Sometimes they only cover certain things. Sometimes they only cover a certain amount of visits. But we're not really there yet where it's fully covered with insurance. So it's typically out of pocket. My first visit is about an hour and a half. I charge $120, and then follow-ups are an hour at $80, which is pretty typical around. Yep.
One of the things I learned from a woman who is a psychic, she said the trouble with Western medicine is that it's invasive, whereas Oriental is more spiritual, and you don't have to go in and do all this surgery. You can heal from what you're doing through the mind, the power of the subconscious mind, and just relax and don't worry about it, and you come out all right. It's when you stress, it gets worse, like cancer and all the rest. And I saw it happen, and it killed my mother. I couldn't get her to relax. I was on my deathbed a number of times, and and I said, to hell with it, I'm going to die, so what? Here I am.
Well, one thing I really love about it too is, when you're lying on the treatment table too, or what I encourage is it's coming sort of, really sort of understanding your body, right? Too often we are in pain or we're under stress and we just need to keep push through it, so let's pop a pill, and we just ignore really what our body's telling us, right? Like, when we're feeling uncomfortable for some reason, that's a message your body is telling you about something, right? But we don't really take the time necessarily to say, what could that be? And then take the next step further and be like, well, what steps do I need to change, right? It's very hard to change our behavior, right?
Step back and say, oh, that's what caused it, and then you solve your own problem.
Yeah.
Right.
So, anyone else have any questions before we get to the acupressure part? All right, well, I'm assuming everybody has at least one finger or one thumb on their hand, so if so, then that's all you really need to do acupressure, right? So really what it is, it's being able to stimulate an acupuncture point, just not insert it invasively with a needle, but using your finger or thumb to activate that point for its healing properties. So this is really sort of the quick and dirty of it, and I'll pass a handout around at the end so you guys can take that with you. So all you really need to know is where to locate a specific point that you want to activate, And then you really just apply pressure on it with your thumb or finger for about, 30 seconds at least. And you want it to be, significant enough pressure that you're activating it, not just sort of lying it on there, but not so hard that you're like, creating pain for yourself. And most points are sort of what we call bilateral, so they're on both limbs. So you can push a point on one side and then go ahead and push it on the other. And I would honestly encourage you to do this, several times throughout the day. One time is better than none, right? But more often that you can do it while you're, in a meeting or watching TV or what have you, the more often you do it, it will be better for you. So let's look at some of the points that I use in my treatments. We'll start with the easy ones to locate on your inner forearm here. We're going to look at this one here that's under sort of the thumbnail. Pericardium 6 channel sort of starts in your chest and goes out toward your arm. The pericardium is sort of that heart protector, right? So it's going to be, these points are going to be really useful for stress and anxiety. This first one, lifting your mood. It also treats insomnia, poor memory, and depression. So if you look on your inner forearm, most people have these two tendons that go down your arm. If you only have one, you're going to be pushing on the side that's sort of towards the pinky side. And if you locate your wrist crease here, you take your thumb. Easiest way to find it is like 2 thumb widths down from the wrist crease in between those 2 tendons here. And so you want to push gently on it. And actually, these points on the pericardium channel, we also use to treat carpal tunnel. So don't push super hard on this because you're going to, activate your carpal or push your carpal tunnel here. But that point here, pericardium 6, I use a lot. And incidentally, which I tell a lot of my anxiety patients, I don't know if you've ever seen at CVS, Walgreens, those things you could buy, they're called C-bands, SEA bands, for motion sickness kind of thing. Essentially what they are is a sweatband with a little plastic circle on it, and you're supposed to wear them at your wrist because it's activating this point, right? This point's great for nausea, but really great for anxiety too, and sort of opening up that chest. So I say, go buy a pair of C-bands, put them on so it's activating this point between treatments. Wear them on one wrist, wear them on both, so that's sort of an option too for this point. And then pericardium 7 is just further down, right at the wrist crease here, between the 2 tendons. And this one I would sort of use more for a more severe case of anxiety or more emotional upset. But you can easily do both as well. So has everybody sort of found those?
You know what? I wish I had known this 100 years ago when I was in the Navy, because I suffered from severe seasickness and vertigo, and I still take the pills, the Phenergan. If I had known that, I never would have had it, but I didn't know, so I had to search and search and search for these Phenergan tablets which anesthetize the stomach, and then I'm floating and I'm happy. But as soon as I go off it, it's all over.
Yeah. So those C-bands are really great, but this is a good point for, like I said, nausea too, definitely. So anyone have problems finding those, or want me to check where you're locating it?
The 7 is right at the wrist, right where you see the crease? Or?
Yep. So.
Is it there?
Yep, exactly, right there. So your 2 tendons are here. So the pericardium 6 one is about there, and then 7 is right here.
It's in between those 2.
Yep, and I push and I rub too. I do that a lot. You can just push down or you can rub, either way. Yep, perfect.
Just do both.
Yeah, do both, yeah.
I'm not sure what's what here.
You kind of only have one, so what I do is about 2 widths down on this side toward your pinky of this tendon that you can feel. Yep, right
So
in
that's
there.
the tendon right there?
Mm-hmm.
Okay, I thought that was a bone.
Nope. Yep, ropey tendon right there.
Oh,
And then
okay.
the 7 would be right up here.
So I only have one. Is that unusual?
No, I see it frequently. Yeah, and it's probably there. It's either just hidden or some people it's just one is more predominant than the other. Yeah. And while we're on the same area, we'll look at another one called Heart 7. The heart channel is more on the lower aspect of your arm out to your chest. This one I use quite a bit for anxiety and those people who are, really running on empty. Anyone who has heart palpitations, I will use Heart 7. So again, on the inner side of your arm, there's another tendon that runs on the outside if you can sort of push in and feel. And this one's going to be on the thumb side of that tendon right at the wrist crease. In the Heart 7, or heart channel, there's a lot of points really close together. Heart 7, Heart 6 is right below. Heart 6 is really great for night sweats and hot flashes, anything like that. So when your whole thumb is sort of pushing on it, you're kind of activating all those things together. So Heart 7's right here at the wrist crease. Anyone having?
Yeah, toward the outside of, is that what you're saying? By the patient?
No, on the inside of it. So here you can feel that tendon. So it's on the inside or at the wrist there.
Like here?
Yeah, like right in there.
Okay.
Mm-hmm. Here tendon, you feel that ropiness right there? So it's going to be on the inside right there. Up on the.
How do you know when it's working?
How do you know when it's working? When you feel more calm. Yeah.
Okay.
Anyone else need me to check? All right, now we're going to go to our feet. This is my favorite point in the body.
Put my shoes on.
What? You don't have to. You can do that at home if you want. This is probably my favorite point. I don't know why. I think because everybody could really use this point. I love it, needling it on myself. Most people could use it. It's just one of those just grounding points. So it's really good for stress, for that impatience, that irritability that we have. It's really good too for headaches because it's grounding. It pulls everything down, releases tension. So it's going to be in this space between your big toe and your second toe, in this sort of depression. It's sort of at the deepest part of that depression. And I would encourage you kind of feel, push around, and you want to feel at the point that's more sore, and that's going to be the spot that you want to push it on. Is it sore for you? Yeah.
A little bit, not bad.
Yeah.
You can definitely find it if you feel around.
Yeah,
A
definitely.
little bit sore,
Most people it will. Yeah. Mm-hmm.
so you keep it 30 seconds in the same.
At least 30 seconds, you push down or kind of rub around, and then maybe switch to the next foot, do that while you're watching your show, sort of alternate. Yeah. And, if someone, you're on a phone call and you're really agitated, something's going on, just start doing it. Or you start to feel those shoulders creep up towards those ears, great time to do it,
All them the gotchas,
Yeah.
right there.
If you think about like your hand, we were talking about why would you need a one place versus another, right? Your foot and your hand are kind of like mirrors of each other, right? Your toes and your digits. So that point, liver 3, couples with this point on your hand, which we call large intestine 4. So it's between these two at the depression here. This one is great for anything really on the face. Use it for all headaches. And these 2 points together, we call them the 4 gates, if you did your 2 hands and your 2 liver 3s, because it's such a good circulation system that we activate in the body, which is why it's great for stress, tension, anyone with migraines, things like that. So we call those the 4 gates that you can do. And then I threw in the ear, because the ear is sort of what we call like a microsystem of the body, where you can kind of treat the whole body with just the ear. I should have put on a picture, I don't know if you've ever seen, where it's like an inverted person on the ear, where your head is more at the lobe in your spine, like curves up. So really, you can use the ear a lot with needles or, with acupressure. So if our brain is more at our lobe, you can just sort of like, massage your lobe for a little bit. And then this point here that I circled in red is called Shenmen ear point. Really great point for so many things. So you can kind of reach up and rub that sort of triangular fossa part of your ear. It alleviates apprehension, fear, anxiety, regulates that sympathetic nervous system, but treats a whole host of other things, inflammation, pain, addiction, that kind of thing. So I don't know if you can come and see, I have what's called press balls in my ear. So sometimes between patients, I'll maybe put needles in, but then between, I'll put on these things called press balls to keep the points activated between treatments. They're just these little silver stainless balls. I'll show you if you come up and see on like a clear sticky. So it's not insertive, it's just lying on the skin, pressing on that point to activate it, between when I see people. So if anybody wants me to give them some press balls on their ear today, I'll just have you sign my little form and you can put these on, and you can keep them on your ear for 5 to 7 days. It can't hurt you. If they become irritated, itchy at all, you just peel them off and put them in the trash.
So I have a question. So you're talking about ears and the acupressure point. What about when people pierce their ears and have piercings all over their ears? What does that do to the acupressure points, or does that mess up things?
We don't talk about it a lot, but it's been in conversation, between acupuncturists. And now, I've gotten a couple questions from people about like, oh, what if I pierce this ear? I forget what it's called, for migraines. I think it's something that's become popular. I don't know, to be honest. Some might say, it can sort of activate the point, but I think, if you're sort of clearing out an area, well, I shouldn't say that, because people say, oh, I have my spleen removed, but you can still, that has nothing really to do with the spleen meridian that we treat. So I don't know. I don't have a good answer to that question.
Oh,
Yeah. Yeah, no, it's a good one.
Who has quite a few piercings.
Yeah. And like I said, some would say, oh, you're really now activating that point, but others would say, well, you're kind of now shot through it, so yeah, you don't have it to treat now, kind of thing. Yeah. So
maybe, like right now, I'm since I haven't eaten or had anything to drink, I know I'm going to get vertigo. So the only way I can stop it is to what? Do this until I can start to eat.
you could, or I'd push the liver 3 on your foot to ground you. If you're dizzy, everything's up here, you need to ground yourself. So I would do the point on your foot.
Okay.
And you need to eat breakfast.
Good. Okay.
For sure. Anyone else? Anyone have any questions? No?
What do you do for here?
For the tight neck and shoulder? There's a really good one called Gallbladder 21. If it's sort of like halfway between where your neck is to where your shoulder ends, right on that top of that trapezius muscle. And if you like push on it, it kind of is tender, right? Or if someone were to put their, elbows on you, like, right? So that's a really, really good one. And it's kind of almost a trigger point for that trapezius muscle to let everything relax.
That's all the gotchas.
Yeah, the gotchas, yes.
They do tighten up really quick.
Yeah. And it relaxes a lot of things, because it's a very grounding point, this point, which means it helps things sort of descend. This is a complete aside, but people who are pregnant and they want to go into labor, I'm like, have your significant other push on those points, because it's a very grounding point to help loosen everything, and that can help stimulate labor. Yeah.
Some people are really tender about that.
Yeah. So that's the best one for shoulder tension. Yeah. Any other questions or need to find spots on you? You can come up and grab, either a book that you want, or here's a handout I have of the slides if you want to be able to locate these here. You're welcome to take a copy. And if anyone wants me to have press balls, I'll just have you sign my little consent form here. And then we'll go from there. Okay? Thank you.
Thank you very much.
Appreciate it.